Welcome to BuildINC Business. I'm your host, Marsha Savage, and today we have Dr. Lamara here with Scenic City Counseling. Dr. Lamara, tell us a little bit about you and what separates your counseling from other counseling services.
Oh, sure. So, I've been a therapist for over 20 years. A lot of my experience has been with the military.
Okay.
I worked with active duty soldiers and with the Veterans Affairs in a couple of different cities. I moved around the country quite a bit, so I have some experience really dealing with first responder populations. I've had a wide variety of experiences from hospitals and even more recently, before I came to the incubator, within a primary care setting. So really, I think what separates me is my down-to-earth approach, really meeting people where they are, and being able to apply really crisis management to situations. My specialization is in trauma treatment, anxiety, and depression.
That's great to know. It's definitely needed, especially in these days, right?
Yes.
You had some big success earlier this year, correct?
Yes.
Can you speak a little bit about the TVFCU LEAP Grant and, your success with that?
Oh, yes. So this year has been a big stretch. Actually, it started the October before, kind of what's going on now with TVFCU. And being able to win second place in the TVFCU LEAP Grant, the $15,000 there. So it was a wonderful experience. It allowed me to stretch myself a bit, meet some new people, and make great connections.
Got you. Do you have any success stories that you've been working with them on, and anything that, might help us get a better view of your services?
This past, week, we've had a lot of challenges within the city, and being able to be available, to work with officers and their families as necessary, to respond more quickly, as opposed to a person being on a wait list or not having the opportunity to get in, sooner rather than later.
Yeah, I know a lot of people used to think, bad of counseling or therapy. When I say bad, it was just one of those things where it seemed like you had a crazy crisis going on for you to, utilize those types of services. How have you been able to make people more comfortable with your sessions?
What you're talking about is stigma, right? And it still exists, although it is better. And I think COVID really helped to make mental health more the common reality for people. It's like, oh, I'm experiencing this too, in this unknown charted territory with COVID. But because of that, I think that I've been able to really connect with people, just talk on a regular basis, talk about what anxiety and depression look like in everyday life. Being able to explain on a continuum that it's not necessarily suicidality, but it might mean that you're sleeping too much or you don't have any motivation or to do things that you want to do before. Part of my LEAP Grant initiative is to bring mental health to the public, going into different entities within the community, making mental health awareness the standard, and so being really able to talk about it, and also social media. My assistant Talisha and I make videos, they're kind of funny, but make videos or, really try to stay connected through social media to educate the public as well.
That's good. That's good. How did you hear about the incubator? I'm curious.
So being a part of the chamber, I started off with the business literacy series and just getting in that business network, and learning more about the chamber. And again, right around that time of the TVFCU LEAP Grant time frame in the spring, and then later I got the opportunity, in the late summer, fall time frame to become a part of the incubator here.
Okay, and what drew you in? I know you got to learn about it through, the ecosystem and the business literacy series, but what made you say, yes, I'm going to apply, yes, I'm going to house my business within the incubator?
As I looked into it more, it was a no-brainer in a lot of ways. I mean, obviously there's some advantages from a financial standpoint, but more than that, I think it's the community and the business mindset. Being in an environment where everyone's pretty much motivated, where there's programming, where there's that sense of community and people wanting you to excel and do well, but also providing those support systems.
Got you. As you're growing and developing and scaling your business, what are some new things that you can already foresee on the horizon for you for 2026 that you might be able to share with the people?
I can share a little bit. So I'm really wanting to beef up the groups that are offered. Okay. I also want to do some workshops within the community, and being in this location and having the resources and the rooms and everything, being able to have people come on location to participate in that. So that's one of the big things. Also thinking about a podcast. So we've been playing a little bit of that and playing around with it. So I'm looking forward to what that develops into.
cool beans. Where how can everybody contact you? Is there a website or something people can learn more at?
Yes, so because earlier in the year we might have been known as Scenic City Therapy because we were. We did also experience a name change, but currently our website is still sceniccitytherapy.com. The phone number to reach is 423-403-4393. People can call or text, and even after hours I do have an answering service so that we don't miss anyone, and we'll definitely get back the next day.
Well, thank you, Dr. Lamara, for visiting us today. And thank you guys for tuning into BuildINC Business. This was a great episode. If you would like to learn more, feel free to visit her website, and we'll see you on the next episode.